Thank you.
All right, so
እኔ እናንተ ብቻ ነን ወይስ ሌላም ሰው አለ?
ዶክተር በዳሶ አለ። So ትንሽ የተወሰነ ኢንትሮዳክሽን ልስጥ እና ቻሌንጃችንን እንጀምራለን ማለት ነው።
እሺ።
All right, so ዶክተር በዳሶ ምናልባት ዶክተር ህሊናን ስለማታውቃት kind of introduction ልስጥ። Dr. Hellina Kassan, she is a graduate student of St. Paul's Hospital College, and she is now and she is a lecturer and a medical doctor at St. Paul Hospital, and she's also a co-writer at WizKid Foundation, and also she's working on the mindset program. I don't know if you know it. She worked with Dr. Mehret Depebe, a kind of a mindset work activity which has started on the COVID pandemic. So she's our guest. So today we are going to ask a few questions regardless with the about One Health. So I hope it's going to be a wonderful time. So let us start our challenge. So Dr. Hellina Samashan.
ይሰማኛል።
All right, so ስለ ዶክተር በዳሶ ደግሞ የተወሰነ ኢንትሮዳክሽን ላንቺን ልስጥሽ። ዶክተር በዳሶ he is a veterinarian. He studied his first degree, Doctor of Veterinary Medicine, at Addis University, and he did his master's at in India, and he is now accomplished his PhD at Cambridge University. So our today's One Health challenge is going to be held on English because since One Health is a global concept, and this video is going to be uploaded on YouTube. So many individuals are going to see from different parts of the world. So we are going to make our interview or our meeting through English. So Dr. Hellina, do you hear me? I think.
Yeah, I can hear you.
All right, so I'm going to call the first question. Since you are a medical doctor and you studied your first degree on Department of Human Medicine, right? So what is One Health for you, regardless with the from the angle of human medicine? How physicians understand One Health?
So it's a very new concept, and I got introduced to it through you and Mexican. So
okay, can you make a video
like I'm outside, I'm not sure if it's
try your best. All right, good.
Yeah.
Okay.
So yeah, I got introduced to the concept through you. I haven't heard about it or have read about this concept until the last time you made several posts about it, and you've contacted me to reach out to Dr. Mehret, and then I tried also to link you up with a few doctors. So I honestly am new to the concept, so I don't have that much to say about it, but I'm really intrigued and keen to learn more. And yeah, I'd like to contribute to your post once I understand what the initiative and what the what it stands for. So I'd like to learn more about it from you.
All right, Dr. Hellina. In fact, it's something which is really, actually One Health is a new concept. So Dr. Bedaso, let me give you the a chance for speaking about One Health. You are really hear the answer which is replayed by Dr. Hellina, which is she's a physician, and now she's currently study her public health course at UK School of Hygiene and Tropical Medicine, right? So she replied like it is a new concept for her, One Health. And the concept One Health is more and predominantly here by the veterinarians and to some extent social experts. So what do you say about that?
Well, thank you for giving me this opportunity to join your platform today. And I'm pleased to meet you, Dr. Hellina, you too. And so just to say some few points on this, I think this has been a subject which has been brought into the scientific arena probably long time, and it used to be like called one medicine, which is involving studying diseases about affecting both human and animals. On it used to be called one medicine. And then finally, people started to think about environment as well, because when the environment is healthy or hygienic, then by default, animals living in the environment would be apparently they will be looking hygienic or healthy, which finally, in one way or the other, will affect the public health. And there are evident data globally that nearly 70% of public health problems are emerging from animals. So, so there's a trade of or triangulation of environmental health, animal health, and human health. So one is affecting the other. So there is a clean environment, which means that animals living in the environment, like be it domestic or wild animals. So all animals could be carriers of diseases from the environment. And then in most of the world we live in, people are living very closely with animals, or we consume majority of food of animal origin, like meat or milk, eggs, and fish and the like. So in one way or the other, human life is strongly associated with animals. So there is possibility that disease would definitely emerge or spill over from the animals or from environment into animals, be it domestic or wild, then from animals into human. So there's a need to triangulate these three disciplines and talk about One Health. So One Health is having all this in trade, and it's, I think, important subject which is actually mainstreamed mainly in developed world, and of course in infant stage in developing world, such as, for example, in case of Ethiopia. So I think uh, if I would say this much, it would be good. Yeah.
Thank you so much. That's a very good explanation. I have a little bit of a clear understanding of what it is right now. Thank you.
Yeah. Okay.
All right, thank you, Dr. Bedaso, for your wonderful explanation about One Health. So I'm going to again reflect my question to Dr. Hellina. So Dr. Hellina, you are a physician. You are working on St. Paul Hospital as a resident. So, and you are also a lecturer right there. So I'm going to ask you a question, which is most of the infectious diseases are zoonotic. Like according to who explanation, from 70 to 75% of the infectious disease comes from animal. In other words, they are zoonotic, or these which are transmitted from animal to human. So most of the time, pupils, governments, and also different individuals with their perception, advancing the human healthcare system is only the right and the appropriate option to make a sustainable health on human and also globally to make our universe more secure. But it's what is the most intelligent example for these thoughts is a COVID, because COVID is a current pandemic which is which caused a great disaster in universe, in globally, which is show the healthcare system of those developed countries. You can see USA, you can see Mexico, Brazil, UK, China, India. They do have a lot of an advanced healthcare system. They do have a specialized hospital. They do have a specialized research institutes, but these guys lost their civilians in thousands and 2000s per day. So what do you understand, like as a physician, what do you understand, like advancing only the healthcare system does it's going to make a difference on the health of human being in general in our universe. What do you say about that, Dr. Hellina?
Yeah, for me, it's more of we need to do more work. It doesn't matter if you are in an advanced setting. If you don't have a strong health system, um, you would have difficulties in times of crisis like this, in terms of like emergency, like pandemics or any kind of outbreaks. So for me, it's all about building a stronger health system.
Okay, so let me give you the chance to Dr. Bedaso. I hope you hear
Yeah.
my question. So share some
Okay.
points.
Okay, thank you very much. I think the main important thing which I would like to mention here is that from the point that you mentioned and the crisis of pandemics globally, um, most of developed world, I think, they have a very good resources, medical resources, health policies, and the like. But as far as preparedness is concerned, and developed world is mainly focusing on diseases of non-infectious nature or metabolic diseases, for example. So in terms of like emerging infectious diseases in most of the world, even though they have resources to deal with, like for example, they were capable of developing a vaccine in nearly about less than a year. So they have facilities, they have scientific capabilities, resources, and everything. So they managed to develop of a vaccine, but I would say they have disregarded all these infectious disease problems have been partly neglected in developed world. But in developing world, infectious diseases are always there. People are living with diseases and they're endemic. And again, diseases which are believed to be neglected in developing world are already being controlled in developed world. For example, in case of Ethiopia, for example, the main focus in public health is mainly, which, if I'm not mistaken, people are focusing on TB, malaria, and HIV, and there are a number of neglected diseases which are potentially affecting public health, brucellosis, for example, or other parasitic diseases, which are even not given a case definition by public health authorities. There are a number of neglected diseases in tropics, including Ethiopia. This neglection is simply because of lack of resources. And so government health policies should prioritize the most important diseases affecting public health. So I think the crisis that which we would see in case of COVID-19 has got different scenarios in developing and in developed world. So in developed world, because they have partly neglected emerging infectious diseases, and they are mainly focusing on, because they think they have eradicated lots of diseases and there are vaccines for quite a lot of diseases, and then they're making focus on like cancer, diabetes, blood pressure, and metabolic diseases and nutritional diseases and the like. So these emerging diseases are coming from developing world. For example, COVID emergence was from China, SARS-1 also, SARS-CoV-2 and SARS-CoV-1, both are emerged from China. One MERS-CoV emerged from, for example, Middle East coronavirus from camels. So diseases occurring in developing world could potentially be pandemic. So there's a need to coordinate it, and globally linked up policies should be important to control the pandemics, for example, in case of COVID-19. But the main point which I would like to address here is that it's because of the policy. Public health policies are varying from place to place, and the politicians are focusing on very important diseases which they would be able to tackle with. So these variation in policies are bringing all these disparities and challenges and the like. Yeah, I think this is something that I would like to say.
Thank you, Dr. Bedaso, for your brilliant idea. Really, I'm just inspired by things that you spoke out. So I think the time is running up, so we should have to be complete our challenge to the end. It's going to the end. So I do have two more questions, and we are going to finish our one challenges, our one challenge program. So my question, my first question is that what is the most important thing in your perception, both of you, Dr. Helena and Dr. Bedaso, in your perception, what is the most important way of addressing One Health to globally to each individual country, and how we are going to implement One Health? Really, in this time, One Health is the most important and critical thing, because the need of this collaboration, this discipline collaboration, is now asking our universe to collaborate these three things, because really advancing in one pillar is not going to be the best solution, right? So on your perception, you guys, what do you think about how we are going to be implement One Health globally? How we are going to raise the concept of One Health globally? Let me give the chance first to Dr. Bedaso.
Okay, thank you. I think there has been lots of opportunities and challenges as far as One Health is concerned. And I think in developed world, they are quite well aware of these issues, One Health issues, and they are dealing with lots of diseases. And for that matter, people are advised, encouraged to work outside their professional silos. Like you see people working in interdisciplinary platform, like mathematicians, ecologists, medics, vets, and all working together for the same problem. So this has been the main practice in developed world, but which is actually lacking in developing world. For example, in case of Ethiopia. So what we would learn from the developed world is it's really important to create a platform where a number of a platform where interdisciplinary collaboration is vitalized to deal with public health in terms of like ecologists, environmentalists, vets, and medics, and they all work together to eradicate or at least to safeguard public health. And of course, with this regard, there is one important point is a public health policy, which helps the collaboration between this professional network. And as far as my knowledge is concerned, there is, I think, the strategy to develop One Health policy in Ethiopia is at infantile stage. I have an information that there is one national One Health steering committee, which is actually established by experts coming from medics, from environment, and again from Ministry of Agriculture and the like. So this committee is actually, I think, facilitated by the Ministry of probably Prime Minister's office. I don't know, but there is a structure to set up a One Health steering committee nationally. So apart from this, public health policy is important. Second, it is the professional collaborations, medics, vets, and again, environmentalists, ecologists, and the like should collaborate to mainstreaming, putting this idea into curriculum, and then from making people aware of the concepts, the opportunities, and the challenges would help to prioritize and of course do best things in One Health. So I think this will be an important thing to pay attention to.
Thank you, Dr. Bedaso. What do you say? Let me give you the chance to Dr. Helena. So, Lou, what do you say about this? About the questions that I quoted early?
Yeah, my opinion is also no different from what Dr. Bedaso mentioned. It's basically creating a platform for collaboration, coordination, and innovation. So it's a digitalized world, so it wouldn't be that much difficult to create partnerships internationally. So and creating that global movement and keeping the momentum, and reaching out to the to healthcare professionals so that everyone can be involved, and I don't know, maybe like collaborating with influential people so that it can have a greater reach to the wider population. So yeah, I would agree with what Dr. Bedaso said.
Right. So Thank you very much, you guys. So my final question is, what do you say about our One Health Challenge? Does this thing is going to make a difference in our country, in our country, Ethiopia? Let me give the chance to Dr. Bedaso again.
Okay, I was actually anyway. So I've been to part of this One Health Challenge, I think for some time, but I really appreciate the things that you guys are working. It's very, I would say, like, good job, and I would like you to expand your work. Is like, it's good to have some kind of One Health clubs and One Health communities in universities and colleges, and of course support evidences where, like, um, One Health is really important in terms of, like, we can also set up like small programs, small, like, charity groups which is working on One Health platform in a way that the public would understand how clean environment is important for public health, how animal health is important for public health. So we can design small bit of tasks which are quite useful to understand for the greater public. Again, this I mean this will be started up in universities, colleges, even high schools, for example. So it's good to strengthen your work and boost up your team to extend your activities into, like, lower schools or high schools or private colleges, for example, which are having a public health curriculum or public health teaching programs, for example. So I think it will be good. And then I hope as time passes by, we'll be able to discuss further more options and opportunities that we can work together.
Thank you, Dr. Bedaso. So what do you say about our One Health Challenge, Dr. Hellina? Share us your points.
Yeah, I agree with what Dr. Bedaso has said, with everything he said. So I'll be looking forward to our work together. And yeah, everything that Dr. Bedaso said, I agree completely.
All right. Thank you very much, you guys. It's a big pleasure, and I give you a big respect and big this for attending our One Health Challenge. Thank you very much, you guys.
Thank you for organizing this, Pamela. Thank you.
Thank you very much. Thank you for having me.
All
Have a
right.
good day, you all. Yeah.
All right.